To our esteemed health workers, partners from the Department of Health, civil society organizations, maayong adlaw. Today, I speak before you not only as the governor of our beloved province, but as a concerned mother, a fellow Cebuana, and a public servant who refuses to be silent in the face of a crisis that is growing. We are facing a public health emergency. It is one that hides in shame, in stigma, and in silence. And it's time we confront it with the full force of truth and compassion. The numbers speak for themselves. 5,101 new HIV cases nationwide in just the first quarter of 2025. 57 new infections every single day. And in Region 7, we rank 6th among the highest in new cases. In Cebu province alone, we have recorded 2,280 HIV cases since 1984. With 22 new cases this year, our youth are most at risk, with 80% of infections among 15 to 34 years old, and 92% of those infected are male. This is not just a health crisis, this is a youth crisis, a future crisis, a Cebu crisis. We cannot allow this virus to win because of our fear to talk about it, because we fail to act decisively, because we let stigma define our response. As your governor, I join the call of the Department of Health in declaring HIV as a public health emergency, and I commit the full support of the province of Cebu to this urgent cause. Let me be clear, this is not about blame. This is about responsibility. This is not a time to judge. This is a time to understand. This is not a moment for silence. This is the moment for bold, life-saving action. We need to normalize HIV testing the same way we test for diabetes, hypertension, or tuberculosis. We must bring it into every barangay health station, every outpatient service, every prenatal checkup, because testing is the first step to healing. And no one deserves to be afraid of knowing their status. For those who test negative, we support them to stay protected through education, support, and access to PREP. For those who test positive, we guarantee immediate referral to our 14 DOH-accredited HIV treatment hubs in Cebu province, where they will receive not just medication, but also counseling, monitoring, and care with dignity. We also recognize that HIV is not merely a virus of the body. It is a virus that weakens systems, exposes inequalities, and costs us more in the long run if we do not act with urgency and unity today. To all our mayors, barangay captains, health workers, educators, youth leaders, and civil society partners, we need you now. Let us build a province where HIV is no longer whispered in fear, but addressed with courage and science. Let us build a culture where our youth are educated, protected, and empowered, not shamed and silenced. Let us stand as one to protect the people we love, the values we cherish, and the future we must build. Today we declare, Cebu will not turn away, Cebu will lead. This is not just a policy for our administration. This is a promise for every Cebuano life. Together we will turn fear into knowledge, stigma into strength, and silence into action. To my beloved Cebuanos, padayon ta kay ako ang sugpo. Daghang salamat, let us save lives together.